Hey, everybody. So Thirsty Thursdays this afternoon for ASDA. Just wanted to remind you guys, if you hadn't seen it already like 15 times, we had to move arm wrestling due to a liability issue. I mean, it is pretty serious, but they called it a sporting event, and we can't have a sporting event with alcohol, so that's the way that happened. Well, we'll plan it for later on down the road, and it'll be great. So y'all keep training, practicing what you've been doing. What's that? So not today, but Thirsty Thursday's happening. Hope to see you out there. Come enjoy some free games, free snacks, free drinks, and good conversation. Great, thanks.
Can we settle down, please? Okay, so we're going to round up this series of lectures by looking at environmental diseases, and then we'll move on to, I think you have your exam next week, Friday. You're going to start some classes with Dr. Liu, but the exam is on Friday, and then we'll move on to host response to infections. So I'm going to start by playing a little clip. I hope we have enough
Pollution.
time.
The presence or introduction into the environment of a substance that has harmful or poisonous effects on.
Sorry, I just want to...
The environment, and even us. Pollution. The presence or introduction into the environment of a substance that has harmful or poisonous effects on the environment, and even us. Pollution comes in a variety of different ways. It may come in the water, in the land, or even in the air. There are also two others, much less well known: light pollution and noise pollution. However, those are not the worst of our problems. Pollution can ruin our ozone layer. It can prevent plants from growing, and even kill our animals.
Let us start with a very dangerous, but little known form of pollution now, the dangers of land pollution. Land pollution can be formed through many ways, including industrial activities, domestic waste, and agricultural activities. Land pollution is caused not just by landfills and domestic waste, but also by many other things, including deforestation, which is the cutting down of trees, industrial wastes, such as nuclear substances, mining, and even some forms of mechanization.
Domestic wastes, including landfills, can be a huge problem. Domestic waste is the buildup of home garbage in a certain place. They are of a huge threat to the public. Landfills will attract detrivores and decomposers, which are in some cases not good for the environment. These detrivores can include mice, voles, seagulls, and other nasty beings. Despite all the problems posed by land pollution, that is not the least of our problems. One serious problem posed by us would be the introduction of water pollution.
Water pollution is not something that only comes from one source. It comes from many, and those include wastewaters, sewage, marine dumping, and industrial pollution, which includes oil pollution. Wastewaters are very dangerous, both for your health and the health of your ecosystems.
Sewage would include all feces, urine, and other toxic wastes. If this waste is not treated, though, the bacteria will escape, causing the spread of diseases and impurification of water, leading animals to die. When chemicals are in the water, they will cause immense damage to other nearby ecosystems.
This type of water is referred to as brown sludge. On the other hand, there is also a huge issue called coastal or marine dumping.
When substances are dumped into our water bodies, it will be known as marine dumping. No information about this was kept before the 1990s. Any object could potentially be dumped into water. These may include oil, plastics, and other objects. Oil, however, is one that is very dangerous for the health of our ecosystems. Oil takes a long time to be broken down naturally, and moves quickly throughout the seas. One prime example of this in action would be the famous BP oil spill in the Gulf of Mexico, as shown here.
In case, British Petroleum has sent 7 oil spillage cleanup vessels in order to deal with any potential pollution. Katie?
Under the Bay St. Louis Bridge. So, you see it. I mean, it's raining oil.
Another type of dumping is the dumping of chemicals. If there is too much alkaline in the water, then animals can't survive at that pH level. Indeed, they will die. One other huge method of water pollution would be the dumping of plastics and other objects. These objects choke and will kill over 100,000 marine animals each year. Some beaches may even contain so many pollutants that it can become an animal graveyard.
However, aside from the beaches, there is one place where this is definitely present, in the Pacific trash vortexes. Each one of the two is almost twice as big as Texas, and is only growing larger. These two garbage patches are connected by a string of trash, called a 6,000-mile-long convergence zone. There are vortexes in every major sea or ocean.
But did you also know that there is air pollution? Air becomes polluted when noxious gases or black carbon particulates are released into the air. There are 3 main gases that cause air pollution. These are sulfur dioxide, carbon monoxide, and nitrogen oxides. Sulfur dioxide occurs mainly when coal or oil are burned in power plants. This gas is also commonly found in smokestacks, as shown here.
Carbon monoxide is caused mainly by gasoline equipment. Others are aircraft, diesel and railroads. Carbon monoxide is much like carbon dioxide, meaning that it is a harmful greenhouse gas. Nitrogen oxides only occur at higher temperatures. It facilitates and causes acid rain. It is known to cause eutrophication. It is caused, again, by transportation vehicles and power plants.
Now to move on, a brief overview of black carbon pollution.
This phenomenon may account for 18% of the world's global warming. It causes soupy brown air.
This is only used to describe industrial particulate pollution.
Did you know that nature creates its own pollution too? Volcanoes spew ash into the atmosphere, providing a stream of sulfur dioxide.
The acid reacts with sunlight and blocks it, sort of like what happened on Mount Pinatubo.
Over towns and farmlands, killing more than 300 people.
Windstorms can also kick up dirt and place it in the atmosphere. Forest fires can create industrial-sized smog and can release carbon from the trees into the atmosphere. Organic matter dies, and when they do, they will release their carbon into the atmosphere. Also, when warmed, our oceans will release some of the carbon they have stored, causing natural pollution. Please note that this was all under regulation before the arrival of humans. If not for us, pollution would not be a problem.
Pollution also has negative effects on our ecosystems. Amphibians are hit hardest by water pollution. They absorb water through their skin, so any toxins present get directly inside their bodies. Insects will no longer be able to glide on water, due to the amount of pollution in the form of debris, or oils, in a land ecosystem. When chemicals seep into the ground, plants may be tainted, and will not be able to perform core functions.
It's about time that you face the facts. We must do something about pollution. Pollution is bad for our health. It kills millions of people each year who get heart disease,
Lead poisoning,
and even some lung problems.
and furthermore, 40% of America's rivers are too polluted from fishing, swimming, or aquatic life. What can we do to help this growing problem? We can recycle, plant a tree, get better fuel-efficient cars, or even contact our local authorities and governments to raise awareness and put in place plans to make our community a cleaner, ecological place.
We just passed over the development in northern Alberta of the tar sands.
Pollution affects us through the air,
the land,
And the waters. This is something we must be aware of as we proceed into a hopefully greener future.
This is a good day. It's a good day in the fight for cleaner air.
Okay, I just thought that was supposed to be like a quick summary of what pollution is all about and basically what we're going to be talking about today. Can you hear me okay? Yeah? Okay. So what is a pollutant? It's any substance that is introduced into the atmosphere, as you, from the video, as you just saw. Introduced into the atmosphere, the water or soil, that produces adverse effects on living things and the environment at large. There have also been like people who have come up with different quotes and just basically expounding on that, it also includes organic or natural compounds like bacteria, and also pollution can be extended to include man-made sound, chemicals, and other things. What we need to know is that about every year you have about 22 billion tons of pollutants that are dumped into the seas. And within the United States alone, you have about 4 billion pounds of toxic chemicals being produced every single year. And out of that, about 72 million pounds are known carcinogens. So these are things that are being, this is the amount that we produce in the United States alone. So with pollution, we know that one of the consequences of having pollution is that it depletes the ozone layer. I'm sure everyone has been, is aware of that. You've heard so many times when they talk about depletion of the ozone layer and what it's doing to the Arctic, to the, what do you call that now? Where you have the glaciers and how they're melting away and all that. So anyway, with the depletion of the ozone layer, you have climatic changes, and then you have issues with biodiversity loss, as you can see from the diagram there. And all these things the bottom line is that all these things converge to create, to affect our health in one way or the other. When you have climate change, it causes, one of the things that cause, with climate change, you have desertification and land degradation. With that, people would move from certain areas if they don't have what the means of livelihood or sustenance, and move to other areas. You have population displacement. This will create pressures, additional pressures on the system you already have in place in urban places. So you tend to have like rural-urban migration. And then of course with pollution, like we saw, pollution in land, in water, in air. With land, you have decline in freshwater, the availability of fresh water. Those ones also have adverse effects on the human health. So ultimately, you have this vicious cycle that is set in place that occurs as a result of pollution. So why are we interested in pollution? Mainly because of the effects it has on the environment, on ourselves as individuals or as humans, and also on the animals, and then of course the other things, the other living creatures. So what we just saw when we watched the video was mainly talking about pollution at the societal level, like the environment, the air we breathe, the food we consume, and the level and type of toxins that we're exposed to. But on a personal level, you also have your personal environment, which you tend to, more or less, you are more able to control. For example, if you smoke, you are creating, that is compared to someone who doesn't smoke. There are some, like ones at the societal level, are being monitored or being governed by, like, you have the EPA, the Environmental Protection Agency, you have all these other, like the different authorities that try to make sure that the food we eat, the air we breathe, and all that. But then when it comes to the personal level, our personal environment, that's our own personal responsibility, and it has to do with things like, whether we consume alcohol, tobacco, use of therapeutic and recreational drugs, and also dietary patterns. So basically, the course of this lecture is just going to go over through these things. We're going to look at air pollutants. We're going to look at both outdoor and indoors, and then look at the effects that it has in the environment as a whole, and then also look at those that are involved with the personal environment. Okay, so basically when we talk about environmental diseases, we're referring to those diseases that occur due to exposure to either chemical or physical agents that are present in the surroundings that where we live, where we work, where we go to on a daily basis. So the larger environment, the ambient environment, the workplace, whether you work outdoors or indoors or in a confined space, or whether, and then you have the other one, which is the personal environment. In any of these types of environment, we're constantly exposed to different chemical or physical agents, and ultimately may determine if we develop some disease or not. So from the video and from what we've talked about, so the main sources, you have the air, you have water, and then you have the soil. And so we are daily by just being exposed to that, we have the main methods or the main ways in which we absorb these toxic or these physical or chemical agents that we're exposed to. You have the skin, okay? You know, the skin has a large surface area. So we have the skin where you absorb, then you have the gastrointestinal tract from the things that you ingest, and then of course the air we breathe, you know. So whether you eat solids, water, and foods will affect the gastrointestinal tract, and then you have the lung. And from these major areas or these major organs, either the skin or the lungs or the GI tract, you now have some of them, like some of the toxins or some of the chemicals that you're exposed to will act as those sites. But majority of them are absorbed into the bloodstream, and from there they're metabolized, and they might either be stored in some part of the body like the bone, brain, or adipose tissue. Some of them might eventually get excreted, but some will eventually, during the process of metabolism, be converted to active metabolites. And then these ones are the ones that we really kind of we're concerned about, because those are the ones that create the toxicity and create the problems that we're referring to. Okay, so the effects of these pollutants are dose dependent, which kind of makes sense. Obviously, the more you're exposed to this, the duration and also the amount or the quantity will determine whether the amount of toxins that will eventually get into your body and cause problems. So when we look at the health effects of pollution, we said major from the air, water, and soil. You have when we ask, okay, what are the diseases that are most likely associated with pollution? Without even coming to this class, I'm sure the first thing you think about, okay, maybe respiratory illness, that's the one, the major thing. And then you might think, okay, maybe cardiovascular, you think about headaches, irritability, fatigue, things like that. And then obviously, if those, some of those toxins can be so toxic that they can even cause damage your DNA and may eventually lead to, remember when we talked about cancer and we said that 80% is environmental factors and then 5 to 10 is genetic. So when you're talking about environmental factors, these are the kind of things that cause, and we say it's a series of mutations. So they contribute to mutations, and that eventually you might end up with cancer. Sorry about that. But then studies have gone on, we found out that it's not just limited to those that we can see, the ones that we ordinarily think about, like those organic causes like we've seen. But we also have other conditions like Alzheimer's. It's been linked to Alzheimer's disease, to depression, to obesity, to birth defects, low birth weight, and things like that. It's even been linked to diabetes and autism. I mean, all those things are still kind of, when you say it's linked to, it's still, it's not been established definitively, but there have been studies that have shown that there may be some link. So studies are still ongoing, but it's just good for you to realize that these effects are beyond just, affecting the respiratory system or the heart and things like that. So what happens when these things get into our bodies? The toxins, the physical agents, chemical agents, and all that. First of all, when you refer to xenobiotics, you're just referring to those chemicals, exogenous chemicals in the environment that will get into our system either through inhalation, ingestion, or through skin absorption through the skin. And what happens is that eventually, like I said, they may have effects at the site where it happens, but ultimately in the liver, you have where they are metabolized and the major enzymes involved are the cytochrome P450 that I'm sure you've come across already. So they can be degraded into non-toxic metabolites, become water soluble, get excreted or eliminated. Some may also get eliminated via the kidneys and urine, feces. But in other, some others are converted into reactive metabolites. And one of the things that happens is you have this, a lot of the chemicals, by the time they get activated, they're very unstable. So they tend to produce a lot of free oxygen or free radicals, like free radicals and like reactive oxygen species and all that. And then these things tend to be directly damaging to the DNA. So they have effects on the cell membrane, the DNA, the enzymes, the receptors, and all that. Remember when we talked about cancer, we said normally you have those, we have checkpoints in the cell cycle, like the P53 and all. If there's a mutation in a cell, it would arrest, it will set up trigger off system. Remember when I talked about the RB and the transcription receptor factor that prevents the cell from going from, so normally what you'd have is the cell going through the cell cycle from G1, going on to the S phase and all that. So this kind of stops it so that it can get repaired. If the damage is too bad, it triggers apoptosis or mechanisms that trigger apoptosis. But obviously, when you have defects with either the P53 and you have mutations, some of them might escape the system and then eventually lead to malignancy. So the toxic effects have both short and long-term effects, and they can be quite far-reaching. So let's talk about the major air pollutants. So we're starting with air pollutants, and we're going to look at the major ones that are outside, then we'll look at the ones that are indoors. The major one you think about outdoors is the ozone layer, and that's one that tends to affect most individuals, whether you're healthy or not. For some other pollutants, sometimes it's the, if the person is debilitated or has other comorbidities, or in children, they tend to be affected more by certain agents. But with ozone layer is something that typically affects everyone. And it's derived from pollutants, like as you watch in the video, and they talked about it, the clip, from cars, from factories, and other sources. And what happens is that, these react chemically with sunlight. And I'm sure you've heard about when you talk about smog, and you see in urban areas where you have a lot of vehicles being used, and you talk about thick smog and all that. So it's a combination of smoke and fog, and it's and that's where you have the ozone layer, the ozone plus the oxides and the particulate matter. So then you also have sulfur dioxide, particles that are less than 10 microns per meter. So when you think about particulate matter, why do you think the really tiny ones would be would be more concern? Why not the bigger ones? Huh? Yeah, well, so when you inhale something, right, what do you have to encounter in your nostrils, first of all? What do you have to encounter? The cilia. So the cilia has mucus. The cilia is what helps to propagate, stuff. So when you have that, it tends to trap the bigger particles. But the little ones manage to escape that system, and then that's how they go in and then get into the system. So that's why those particular ones are really important. Those ones can even go down to the deepest parts of the lungs and create all kind of issues. Then you have the acid aerosols, nitrogen dioxide, and carbon monoxide. Carbon monoxide is both a pollutant, both considered as a pollutant, both for outside and indoors. But when we're talking about outside, we're saying where it's in an enclosed space, like, for example, those who work in underground tunnels or underground garage workers. So it's like it's underground, and then so it's kind of confined, but it's still open in a sense. And of course, the lung is the most affected organ. So this is just a list that talks about the effects of the outdoor pollutants: ozone, nitrogen dioxide, sulfur dioxide, acid aerosols, and the particulates, which are the ones that I said have to really tiny, less than 10 microns. Like I said, the ozone most of these ones tend to affect virtually everyone, whether you're healthy or not. But those who have chronic lung diseases already, or people who are asthmatics, and then in some cases for children are particularly affected. In some cases, they develop asthma, and then for those who already have asthma, it's even worse for them. But generally, the effects are either have to do with decreased lung function, inflammation, and things like that. So let's look at the indoor air pollutants. The number one indoor air pollutant is tobacco smoke, and it accounts for the most number of diseases due to air pollution. I don't want to flog the issue. We already talked about it for the last 2 lectures. So in this lecture, I'm just going to put one more slide on tobacco smoke and then focus on the others. One thing I wanted to mention as well, so when we're talking about indoor pollutants also, we're also referring to the ones obviously in your personal environment. And those pollutants that have to do with the personal environment have greater consequence to us, because of the proximity to that, and the how long or how you can imagine, like if it's someone who smokes like a pack a day, continue, or 2 packs a day, so obviously that person is taking in so much more of the potentially taking in much more of the toxins. So the ones that involve the personal environment are definitely more important than the outdoor. But then we know that the outdoor, just like I showed you in the schematic diagram earlier on, that all the ripple effect it has on so many areas of our lives. So tobacco smoke, carbon monoxide, nitrogen dioxide, asbestos, and then wood smoke. Wood smoke may not be particularly an issue in this country, except obviously even in places where you have barbecues and stuff like that, it's still being done outdoors. But there are still certain cultures and certain places where people still cook indoors, and the type of cooking generates a lot of smoke indoors, and so those ones are, affected to a greater degree. And then we talked about radon already, how I said you can have it leaching from the soil and into homes like in basements, and how it increases the risk of, so radon is particularly harmful to those who already smoke. Those are the ones that are affected more. It even increases the risk of, developing cancer. Then we have the bioaerosols. You've heard of Legionnaire's disease before, and how it started. I think there was a conference that was supposed to be for what? Oh, yeah, okay, so the whole, okay, so then so basically they cause like different types of infections, and then of course you have the allergens, dust mites, pet dander, and things like that. Okay, so the adverse effects of smoking like I showed you a slide yesterday that talked about the different types of cancers. But what I wanted to highlight to this slide is also the fact that you can also have conditions that are not, they also contribute to non-malignant lesions, like chronic conditions like chronic emphysema, like chronic bronchitis, and also myocardial infarction. So, and then smoking has also been associated, strongly linked to systemic atherosclerosis. And so that's why we say that it is the number one pollutant, especially when it comes to indoors. Some of the other effects are there, preterm birth, spontaneous abortions, cervical cancers, and then other types of cancers. And then what it does, in addition to that, smoking tends to potentiate the effect of other carcinogens. So not only does smoking cause its own effects, if you're exposed to other carcinogens, the combination of smoking and those carcinogens would even be higher compared to others. For example, if you smoke and you also drink heavily, there's a synergistic effect. So it's not the 1 + 1 effect, but you have that multiplicative effect. And as you can imagine, the effects of smoking are dose dependent. And so usually what is used is pack years of smoking. And pack years is a function of how many cigarettes have you smoked and for how long, okay? So if somebody says, I smoke 1 pack a day and I'll smoke for 20 years, so that's 20 pack years, okay? If somebody says they smoke for two packs and they smoke for 10 years, That's 20 pack years. So 20 pack years may not really tell you how long, but it just gives you a measure of the dose, kind of like, so which is, or more like the intensity of the smoking. Okay, so you can find, and those who start smoking earlier, the consequences are more grave than if you start later. Okay, when you start like from 15 and all that, compared to if you were to start at 25 or so, or 20. Okay, so let's move on to carbon monoxide. One of the dangers of carbon monoxide is that obviously it's colorless, it's tasteless, it's odorless, so you might not even know. And that's why we have all the monitors, you know, in the house and things like that. People who have died from it weren't even aware, and that's the way it works. Is that sometimes it's so insidious that you don't even know what's going on until you're unconscious, and then you die. So the sources are automotive engines and home oil burners, also cigarette smoke. And why it's so deadly is because it competitively binds for oxygen, where you have the binding sites for the heme ion. And carbon monoxide actually has an affinity that is 200 times that of oxygen. So if you're competing with something that is 200 times, obviously it's going to bind to the heme complex more than the oxygen itself would do. And when it does, it forms carboxyhemoglobin, which is a stable complex. And normally what you want is for it to be able to release oxygen easily. It doesn't. So what you have is a reduced oxygen carrying capacity. And so a lot of times when people die of carbon monoxide poisoning, is really due to systemic asphyxiation. And gradually with the effect and all that you have, it affects your CNS. You have CNS depression, eventually lose consciousness, and then there's death if there's no intervention. One of the things about carbon monoxide that is you can use to kind of determine is the cherry red skin color, and that's what you see when you have acute toxicity. The person at the bottom obviously is someone who's died, so you have a combination of both the cherry red skin color and then I don't know if you also have some liver mortis setting in there. Okay. Pneumoconiosis is very important when it comes to air pollution. This is particularly related to occupation, and it's also referred to as occupational lung disease. So those who are like who are builders, those who work in the mines, those are the people who are particularly affected. And it doesn't refer to just one condition, it actually refers to a group of conditions. And the main thing is the symptoms that you see are mainly due to the inhalation of the dust. And then the body is now reacting to that and trying to overcome it. So those are the changes that you see going on. And so the three main ones are, you have the asbestos fibers, referred to when you have that is asbestosis. Then you have the ones that are due to coal mine dust, and that's referred to as miner's lung or black lung disease. And then you have the ones that are due to silica dust or silicosis. And so you can, if there is inhalation of the dust and then your tissues are reacting to it and you have inflammation, obviously you're going to think, you have difficulty with breathing. As the healing process continues, you have fibrosis, so you have thickening, you have this inflammation, and by the time the macrophages come in, and then you have the fibrosis setting in, you have thickening and scarring. So it takes up the space for where you would have the alveoli, the air, and so eventually you have lung impairment, and it can lead to premature death. So these are just like the asbestos bodies within the lung there. So with asbestos, so I mentioned the fact that you have the ones that are due to asbestos and also the ones that are due to coal or silica. But the most important ones we kind of hear all the time is the one that is due to asbestos. This used to be a big issue, some decades back, where it was used as part of the building for homes and things like that. But gradually, most of them are being replaced. Sometimes you might be in a building and they'll put up a notice and say they have to give a notice ahead of time that they're coming to remove, so they've been trying to remove and replace the ones that have been there, but it's going to take a while to completely get rid of all of them. So chronic inhalation or ingestion of asbestos fibers. So apart from the ones that occur in the home, more often it's more like, those who are part of the profession, those who build ships or, into roofing and plumbing. That's where they tend to use these things more. And then, so the non-occupational will be like, in homes. And also for those who have spouses who work in those places, they come back, in the process of trying to, help wash their clothes and other things, they can take whatever they bring from outside and bring it into the home. So that's also an added hazard. So the two main things when it comes to asbestos and cancer, you have the one that asbestos causes directly is referred to as mesothelioma. It's also known as asbestos cancer. It tends to be aggressive and incurable. The problem about this is that, the latency period is between 20 to 50 years. So it's really, really long. So sometimes trying to prove that this is what caused it might be a bit difficult, but there's some lawsuit. I'm sure sometimes you watch on TV and they say, this law firm, if you're ever exposed or that, contact us and things like that. So they're derived from the mesothelial cells of either the pleura or the peritoneum or the pericardium. So you can have pleural mesothelioma, peritoneal mesothelioma, or pericardial mesothelioma. But the one for the lungs, the pleural one, that's the one that is the most common type. And as you can imagine, you have shortness. So what happens is that you have those fibers, they get ingested, inhaled, and a lot of times the macrophages are not able to digest them. They set up an inflammatory reaction. They try to engulf them. They are not usually successful. And then you have this series of events that eventually chronic inflammation, and then eventually you have cancer. But in addition to asbestos causing mesothelioma, if you're exposed to asbestos, it also increases your chances of having other types of cancer like squamous cell carcinoma or adenocarcinoma. So that's enough for air pollutants. Let's just look at alcohol. So in the little red box there just says what's considered a standard drink, right? 12 ounces of beer. Table wine and all the other fancy things. Statistics show that you have more than 10 million chronic alcoholics in the United States as of today, so it's a huge problem. But it's responsible for about 100,000 deaths. Half of those deaths are mainly due to, being intoxicated, you're impaired, and then you have an accident, or you're so depressed, you commit suicide, or you get into a rage and you kill someone and all that. 25% are due to liver cirrhosis. With alcohol, it's usually metabolized in the liver, but about 10% less than 10% are excreted unchanged in the urine, sweat, and breath. And so it's the one that is excreted in the breath. That's the principle behind the breath analyzer test that you do if, a cop stops you and all that. So the studies have shown, so the amount that you exhale is proportional to your blood alcohol level. And I'm sure you all know this, what is considered as intoxication, 8 bottles of beer, I think that's a lot. 12 ounces of wine. And then at levels greater than 200 milligrams per deciliter, that's when you start having issues with drowsiness, stupor, coma, and things like that. So if we look at alcohol, what happens is that it's metabolized in the liver, and there are 3 main enzymes. You have the alcohol dehydrogenase enzyme, the cytochrome P450 isoenzymes, and then you have the catalase. The effects of alcohol intoxication depends on, the effects can be acute or chronic. If someone drinks too much in one sitting, the effects are mainly related to the CNS, but you can also have gastric or hepatic injuries, but these ones tend to be reversible. But for chronic alcoholics, the main organ that is affected is the liver, also the stomach, but number one is the liver, as you already know. But generally, it tends to affect most of the other organs in our body. One of the things that happens is that you have fatty change or steatosis, and that's where you have the accumulation of fat droplets within the cytoplasm of the hepatocytes. Then you have inflammation within there. You have cirrhosis, where you have, so with cirrhosis, what you have is cellular degeneration, you have inflammation, and then you have, in response to it, you now have fibrosis. So you have these fibrotic nodules within the liver. So when we talked about cellular injury, how does the liver regenerate? When we talked about the liver, so if you cut out, hyperplasia, so increase in, so what happens if you cut out a piece of, like it regrows, so yes, okay. But when this is now widespread throughout, and then you start having, really big issues. And then one of the things, again, when you have all the fibrosis and all that, it affects the blood supply to the liver, so you have damping back of blood. The veins swell up, the veins in the esophagus that is leading there. So you have esophageal varices developing, which just means like because of the blood that is now welling up there, they kind of dilate, and sometimes they can rupture and cause massive bleeding that can be fatal. Those who are alcoholics tend to have, they don't eat well, you have thiamine deficiency because of the effect of the alcohol as well, and then they have peripheral neuropathies and this Wernicke-Korsakoff syndrome. That's when you hear that, it's really related to alcohol, chronic alcoholism. They have abnormal gait, they have vision problems, they have memory problems, memory loss, and sometimes they say that you've heard of confabulation, right? You can tell all kinds of long tales. Acute and chronic pancreatitis, fetal alcohol syndrome from mothers who are pregnant, where the baby can have low birth weight, growth retardation, which you have growth retardation, microcephaly, and all that. And then finally, alcohol can cause increased risk of cancers of so many, like the oral cavity, the esophagus, the liver. And then, of course, like I said, if you take alcohol and then you also smoke, you can have a potentiation of that effect. So these are just pictures. On the top left is the macronodular cirrhosis, and that's for how the liver, you can see how it forms those big nodules, and they are just where you just have this fibrosis, and it's really, so the function obviously is also compromised, and then you start having all the issues related to all the things normally the liver, the functions, and what the liver would normally do. And that's obvious. You also have ascites, where you have accumulation of fluid in the belly, and that's what you see with that lady. And then to the extreme left is where you have the esophageal varices. The extreme left, you see how it's ballooned up, where you have dilation of the veins because of backing up the blood there, and they become weakened, and then now start forming pouches, and they tend to rupture. They can rupture and bleed easily, as you can see in that other diagram. So we're going to move to, in addition to alcohol and air pollution, we also have heavy metal poisoning. Most common heavy metals: lead, mercury, arsenic, and cadmium. I mentioned before that with arsenic, you can get that in water supplies that are laced with arsenic. Lead poisoning is also known as plumbism. It used to be a big issue years ago when houses were being painted with lead paint and also being used in the gasoline. Many countries of the world still haven't brought that under control, but to a large extent, it's been, you know, you still have houses here that haven't yet made that transition, but at least there's a law in regulation in place that all the new houses, you can't use lead paints, and children are really vulnerable because sometimes, especially when they leave, you see people renting old houses and the paints have started to flake, and you have those chips, and you know, children, they claw around the wall, the floor, the walls, and things like that. And so sometimes they are the ones that tend to absorb the greatest amount of lead from those paints. And they're absorbed into the bone and the developing teeth. And what happens? Why is because lead tends to compete with calcium for binding to phosphate. So if you look at the diagram there, you see the deposition here, where you have that lead line, and it's usually at the proximal, at the ends of the bone, as you can see there. Apart from it being deposited in the brain, in the bone, it also gets deposited in the brain. And so the children who are exposed to lead, who have been poisoned by lead, tend to have lower IQs than the average children, because and then for adults, what you tend to have is peripheral neuropathies. And then it also interferes with the synthesis of heme synthesis and all that. So one of the things it does in particular is interferes with the cell membrane, so they become more fragile. You have hemolysis, destruction. When you have hemolysis, you have anemia. So if you are losing a lot of blood, remember when I talked about pathology and I said if the blood is, so when you're losing blood on the outside, right, it's not reabsorbed back, so you can't, you get anemia, right? But when you have bleeding into the tissues like a hematoma, the body reabsorbs the iron back, and so you really don't have anemia from that. And so you have what I refer to as lead lines, and these are particularly prominent on not just the radiographs, but also in the gingiva. So sometimes it's rare to see a patient who stays with that, but you can't find them usually at the cervical margins of the tooth layer. You can see that blackish line, and that's referred to as lead lines. Okay, and in addition to you having like when I just mentioned, this is just to show you the different things. For children, I told you can have mental deterioration, the gingiva, and then the other things like the peripheral nerves that are involved, the kidney, and then with the gastrointestinal tract. So you might have abdominal pain. So what I'd like you to do is also be able to at least just have a general idea, because if I was going to give you something on exam, like on toxicity, and I give you a patient presents with this symptoms, definitely put something that is characteristic of that particular lesion. You should be able to know whether I'm talking about lead or mercury or something like that. Okay, so we're going to take a break, and then we'll continue with mercury. We'll come back at 4 and then continue with mercury. Any questions at this time? Any comments?
Questions about the exam.
Mm-hmm.
So today's the last day of material for that? Tomorrow's won't be?
No.
Yeah, because you won't.
Okay, can we settle down, please, so we can finish and leave on time? So I'm going to continue by talking about mercury toxicity. I think it's particularly important for us as dentists. And why is that? Why is that? Why do you think mercury is important as a amalgam? Exactly. So if you don't know one metal, you need to know about mercury toxicity. It's used in amalgam fillings for cosmetic purposes. They're like, you hear about like lipsticks that last for so long. The reason why they last for so long is because of they add lead to it, and it's created like issues. It's also used for diuretics and stuff. So what are the main sources of mercury toxicity? Historically, it used to come from how it was first kind of recognized were in those who used to make hats a few centuries ago. I don't know if you've heard of the Mad Hatter's disease, or when someone uses an expression and says you are as mad as a hatter or something. So mercury nitrate was used to treat the animal force that were used to make the felts for the hat. And they started noticing that in these individuals, some of them started kind of becoming funny, started exhibiting bizarre behaviors. And some of them would also have like tremors. It reminds me more like your, what do you call that, Harlem Shake or something. They'd have tremors, they'd act funny. And so that was the kind of origin. And then they realized eventually they tied it down to mercury. But obviously that's not being used today. But that was kind of like the genesis. And there's a little clip that you can, when you have time, you can watch that on YouTube that just tells you about a little bit more about it. But the main sources of mercury toxicity today is from contaminated fish, particularly swordfish, shark, bluefish, and so you tend to find that a lot in countries that consume that. Mercury levels can approach as much as 1,000 times greater than in the environment. And why it's the fishes? Because rivers and streams are being contaminated from gold mining processes. There was a big one, the Minamata Bay, where you had a constant group of people who developed this issues where you had cerebral palsy. They were having children, and they had cerebral palsy, blindness, deafness, CNS effects, and eventually it was linked to contamination of mercury in the fish in that area. Dental amalgam toxicity is controversial, and you can understand why. You have the proponents and the opponents. You know, the proponents obviously are those who make amalgam. They don't want to see it disappear from the market, right? Then you have, and then it's like we've been using it all these years. You know, so many people have amalgam fillings, and till today, as far as I'm concerned, it's still the best. Obviously, in areas where you can't see, it's the most durable. You use composite. Composite, you have to change it after a few years because it winds down. I mean, it wears down. They've started making better products today, but or making harder composites, but still, it's nothing compared to amalgam. So amalgam is still the best for posterior fillings. So obviously, those who are trying to make a case for these tooth-colored filling materials would also want a way for people to move away from amalgam. So you really don't know. I guess the truth lies somewhere in the middle. But there have been studies that have been for and against it. And as of today, there is no established fact. It hasn't been established but it's more like you'd say probably it may have some effects. What they're saying is that mercury leaches from the amalgam. Then you also have the preservative that is used in vaccines, and at a time, because one of the things you can do is to prevent people from, taking their children for vaccination, and then they end up with all kinds of illnesses later. But it's the ethyl mercury in thimerosal that is supposed to be, that has been kind of implicated, but that hasn't been proven as well. Autism, as we know, there have been all kinds of things like what causes it. It's not yet fully known, and so there have been speculations that perhaps this may be one of the issues. And so when you come to mercury poisoning, you can have the acute one where you have this abdominal pain, vomiting, diarrhea, pharyngitis, just from that, because it's the mercury vapor you're actually inhaling, and then it gets, remember when I talked about what happens when you absorb it and how it gets deposited in, some will create some toxicity at the site of origin, and then others, like when it gets to other parts of the body. But then the chronic ones, you have more, you start having things like neurologic symptoms. For the oral complaints that patients may have, you may have this metallic taste, have ulcerations, they have the gingiva might turn a bluish gray color. There's usually excessive salivation. It's one of the, the thing about mercury poisoning, children, the child, you have excessive salivation. The skin is cold and clammy. Then sometimes, because they're so irritable, you can see them pulling out, like, so they may have patches of hair, missing patches of hair from just the pulling their hair, and also the other symptoms. But in infants and children, there's a condition, acrodynia, which is also called pink disease or streak disease, and that's what the picture where you see this bright pink kind of discoloration of the hands and feet. In the mouth also you have, in addition to having gingivitis and the excessive salivation and metallic taste, they sometimes have premature exfoliation of teeth. Okay. So enough for heavy metals. We've looked at alcohol, we've looked at cigarettes, we've looked at the cigarettes with other air pollutants, we've looked at heavy metals. Now we're going to focus on therapy, on drugs, both therapeutic and then the recreational drugs. For therapeutic drugs, the one that I really want to focus on is the HRT, which is the hormone replacement therapy that it used to be very popular some decades ago as a treatment for hot flashes for women going through menopause, because it helped to relieve some of the symptoms. But then, there was a large study, the Women's Health Initiative study, where they did over 100,000 women that were followed over time, and they found out that because with the hormone therapy, you can have like different therapies. You can have estrogen alone, or estrogen and progestin. And studies show that you have an increased risk of endometrial cancer. So when you have unopposed estrogen, you have that occurring in. So when you have unopposed estrogen, so you have hyperplasia of the endometrium, and this is like, as obviously when you have increased growth and all that, the chances of you having a mutation or something escaping from the system that, like a mutant cell, it's much higher. There's a 10-fold increase after 10 years of use. When it's like 5 years of use, you have less, but definitely the longer you urinate, the greater the risk of having endometrial cancer. With estrogen and progesterone, it's been associated with an increased risk of breast cancer. And also estrogen alone or with or progesterone have been associated with deep vein thromboembolism. What is thromboembolism? Blood clot on the move. How is how is that different from embolism then? Okay. Okay. So, okay. Blood clot on the move. It's a good thing I'm not asking you for filling the short answers, because I'd have a lot. Okay. So DVT, pulmonary. So if you have pulmonary embolism, where do you think it likely originated from? In the leg. Okay, good. I see some of you have started to open your books. You also have increased levels of high-density lipoprotein. So which is the good protein? Which is the good? So when you talk about HDL, which is the good? When you talk about cholesterol, and HDL is good, right? And LDL is bad. So estrogen and progesterone have actually been shown to increase the good one and reduce the bad one. So one of the reasons for the study they did was to see whether it could be used as a preventive measure against myocardial infarction. But what they found out was that the risk far outweighed the benefits, and it didn't really have that desired effect on myocardial infarction. And so that caused a massive drop in the number of women who were taking HRT once the results came out, because we found that it actually increased other types of cancers and didn't really do much for myocardial infarction. With oral contraceptives, you have the risk of cardiovascular disease is particularly high in women who are above 35 years and who smoke. Okay, the effect is not as much in those who don't smoke. Then you have increased risk of cervical cancer among those who have HPV infection. And then you also have thromboembolism, just like estrogen and progesterone that you find with hormone replacement therapy. So apart from looking at the hormone replacement therapy, we look at acetaminophen and aspirin. These are things that you tend to prescribe. I mean, aspirin is often prescribed in medical and even sometimes even in dental practice. And it's, as we know, it's supposed to be like act as a kind of blood thinner. It has an effect on thromboxane. And so I'm sure you've heard of when they say someone is on baby aspirin when you get to a certain age and all that to prevent that. So it's an antipyretic and analgesic as well. Of course, one of the issues with aspirin is just the stomach ulcers and the heartburn and indigestion it can cause, which acetaminophen doesn't. But in terms of overdose toxicity, acetaminophen, the effects are mainly on the liver, and you have hepatic necrosis, and then you have other constitutional symptoms like nausea, vomiting, or diarrhea. Whereas for the chronic aspirin toxicity is known as salicylism, sorry. It's seen in those who are taking, like, the chronic users of aspirin for like some chronic inflammatory conditions. And you tend to have a lot of CNS effects and other things. And then the main problem again with that is the bleeding tendencies. So what's a petechiae? When you talk about petechiae, what are petechiae? Mm-hmm. Sorry? Is it flat, raised, non-raised? What is ecchymosis? Okay. What's purpura? Raised. What size? Pinpoint? Is it pinpoint? Okay. Okay, so let's move on to recreational drugs. I guess when I go through the list, you can silently think to yourself how many you've tried or not tried. I'm not going to ask anybody. It says there are 1.9 million cocaine users in the US. I think that list is underestimated in my opinion, but I don't know, maybe. Out of which 15 to 20% actually use crack cocaine. The peak intake is between 18 to 25 years. So you have college kids trying out for the first time. So you have the symptoms are both depending on whether it's acute or chronic. The acute, you can have CNS effects where you have seizures, or cardiovascular effects where you have arrhythmias, or you can have respiratory, affect your respiratory system. And sometimes the thing with cocaine is that sometimes, you can just take the first time for someone who isn't used to it, and, just take a lot the first time and then that's it. What would be considered normal for somebody who is a chronic user can kill off someone who is trying it for the first time. And then, of course, you have issues or complications with women who are pregnant and take cocaine. And then for the chronic cocaine users, you have the things that are important or interest for dentists or for us is like perforation of the nasal septum. And then sometimes, like, there are times I've worked in like maybe a clinic and you see a patient, the weather is really, really hot outside. He comes, he's wearing long sleeves up to here, put something right up there, has a scarf or something, and doesn't want to remove anything. These are things that get you to start thinking. And then of course, for some, increased sweating, they might have things on their faces like rashes and things like that. And one of the things, again, you find out by the time you start seeing the patients are those that come that have, because I'm just talking about all these drugs that we're aware of. I'm not talking about the other prescription drugs that Xanax and things like that people take, but you find out that sometimes when they come to you, like those who are on painkillers, excessive ones with codeine and things like that, you'd see them coming today with symptoms that they just want a reason for you to prescribe something, and you need to be aware of it. You don't let patients pressure you into prescribing something just because, if you don't see a need for it, If not, they'll keep coming back to you, and they have ways around the system, They'll act like, oh, if you don't give me this, I'm just going to die of pain. Okay, so this is, sometimes you can have a foreign body granuloma along the venous path there. And these are just examples. The one on the extreme left, you can see the broadened flat nose, and that's from collapse of the nasal septum. You can see the complication there. So when you're doing your head and neck examination, some of the things you can notice. This is the one on the extreme right is from crack cocaine, where you have missing eyebrows, the lateral half of it. I'm not saying everybody who has missing lateral eyebrows on crack cocaine, but maybe if they have that, they have other things, you can start thinking about it. So the hair thins out like the lateral half. And then you see the guy with the perforated palates there. And so this is like the kind of obturator, like an appliance that you put to fill in the defect. So, of course, there is heroin. You have about 4 million people in the US who admit to having tried it at least once. The main issue, one of the main issues with heroin is the issue of drug purity. The pure heroin can be anything between 2 and 90%. So obviously, depending on how much you can afford will determine. So you can have sudden death from loss of tolerance, respiratory issues, arrhythmia, cardiac arrest. And then part of the issue with heroin, because it's like, usually injected and all that, you start talking about infection, then you can have a septic embolus. You can have a foreign body granuloma at the site of injection. You can have the infection that will go on to involve because it's going right into the bloodstream, you can have it going, to the heart and creating problems or other parts of the body. You have infections on the skin and things like that. And then, of course, one of the big problems is viral hepatitis from sharing needles. And that's why some places you have programs where they provide clean needles for people to use. Then this marijuana, it says it's illegal, but I know where. Colorado, where else has it been made legal? Washington? Okay. Any chance in Texas? You don't think so? Okay. Over 100 million people have admitted to using it at some point in time. The main problems have to do with cognitive and psychomotor impairments and increasing heart rate, blood pressure, and things like that. And then you have the effects from just inhaling. So you can cause pharyngitis from smoking, the pharyngitis, laryngitis, and also bronchitis. So let's quickly move on to the last segment, which is looking at physical agents. We're going to look at mechanical trauma, thermal injury, electrical injury, and then injury due to ionizing radiation. Do you have any questions at this time? Any comments? Besides asking me what to expect in the exam, because that seems to be the recurring, yes. Mm-hmm. Well, first of all, the children are the ones that, you mean, oh, in mercury poisoning, why is it in, okay, because I was thinking you're thinking about that. That's a good question. I'm not really sure why, but most of the cases that they have seen, it's mainly children that it's, I guess maybe the level of toxicity is, the effects are seen more in children. But it's really, the typical cases have been seen in children. I don't really know why it's not in adults, but typically children, yeah. Okay, so of course, mechanical agents, these are things you're already familiar with, so I'm just going to breeze through them. Even without showing, I'm sure you can tell the difference between abrasion or contusion or laceration or an incised wound or a puncture wound. Like a gunshot injury is a special type of puncture wound. Okay, incised wound, like even from a stab wound from a knife or a broken bottle, or sometimes from surgery. So it's usually neat and clean. They will heal by primary intention and things like that. I mean, if it's surgically induced, obviously it will, you won't have infection, and then most of the time it heals by primary intention. Then you have laceration, where the edges tend to be kind of ragged. Contusion is due to blunt force injury, so you can have that hematoma forming. And then abrasion, obviously, is just when you have skin scrapes and things like that. So it's just the superficial layers that are involved. But all these things so these are soft tissue injuries. I didn't really focus on fractures and types of fractures, compound fractures, green stick fractures that you tend to see in children and things like that. But the type of injury, of course, will depend on what is causing, the object that the person has collided against, the force with which the person collides against that, and then the organs that bear that are in the direct path of that thing. So, of course, these are things you're already kind of familiar with. Laceration, incised wound, when you have contusion, abrasion, and puncture wounds. Okay, so let's move on to thermal agents. We have excessive heat or cold. Obviously, in Texas here, the heat will be of more concern to us than cold. But of course, you still have all those like people who go mountains, issues with frostbite and things like that. But we're going to focus on heat. And in particular, we're looking at, the first thing we're going to look at is thermal burns. These tend to be more in children. They don't know something is hot, they pick it up, and they get scalded and all that. So the effect will depend, obviously, on the depth or the degree of the burn, whether it's just superficial or right down to bone. You'd see if it's right down to, if it's full thickness, it will be whitish. It affects the nerve endings, so you see, as opposed to, it won't be as, but when it's like when it's a little more superficial and not through the full thickness, you have a lot of the inflammation, swelling, and things like that. Then it also depends on the percentage of the body space that is involved. By the time you have more than 20% fluid more than 20% involvement of the body, usually what you have is fluid moving into interstitial spaces, and you can have hypovolemic shock. Remember, what are the other types of shock we talked about? What is shock? What is shock? Yeah, what is shock? Sorry? So it's more like something that is systemic. So you have systemic hypoperfusion, okay? So it's due to different causes. We talked about it may be cardiogenic, it may be septic, it may be hypovolumic from loss of blood. We talked about some, it may be due to trauma, maybe due to sepsis and all that. So by the time you have more than 50% total body involvement, you really have the chances that you're going to have grave consequences. So the effects are not just dependent on, okay, this is the site of injury, this is the surface or the size that was involved, but it's also involved cases where you have, whether you have the presence or absence of internal injuries. You've inhaled smoke, what has that smoke done? Or what, and in addition, the heat that was there, the accompanying heat, what has it done to the organs on the inside? So the inhalation of hot and toxic fumes, obviously the first place is most likely pulmonary involvement, and then that can trigger off a lot of other changes. And then, so what is also important about what happens eventually is how quickly intervention is instituted and whether they're able to put in measures to prevent wound infection. Wound infection is a big killer. So when you intervene, the first thing is because when you have burns, especially when it covers a large surface area, you have a lot of fluid loss. And so one of the things that you want to do is to restore the fluid and electrolyte balance. And then you also want to prevent wound infections. When you have inflammation, what's the difference between bacteremia and septicemia? What's the difference between bacteremia and septicemia? In the septicemia, also you have the toxins, but the main thing really is that in bacteremia, you can have bacteria present in the blood and it's not causing any harm. So yes, it may be due to the toxins, it may just be the shear load. Just by doing any dental procedure, like if you do cleaning, you do have transient bacteremia where blood gets into the bloodstream. When you start having issues, maybe somebody already has some other comorbidities, issues, they're already immunocompromised, or maybe they're diabetic, their immune system is down, they have HIV or something, and also the quantity, that gets in. So for bacteremia, really, you can have bacteremia just means that bacteria is present in the blood, but it may not necessarily be causing harm, depending on the type of bacteria, the quantity, and so many things. But when you talk about septicemia, it actually now has an effect. And like you said, it may be the toxins it's produced or other things, Okay. I hope you remember, what's the difference between dry and wet gangrene? We talked about that. What's the difference between dry and wet gangrene? What is gangrene? Necrosis of what? Bulk, tissue in bulk, right? As opposed to infarction like a small. So what's the difference between wet and dry gangrene? So wet is when you have superimposed bacterial infection. So that's the one that is more harmful, or more the one that is of, yeah. If you want, yeah, better not to have any, but if you must have, in other words, don't let it have the additional burden of having infection. Okay. So in terms of preventing wound infections, the most important microorganism when it comes to burns, when you talk about that tend to create problems for people who have burns, is the Pseudomonas aeruginosa. Other ones like Staphylococcus aureus and Candida can also create problems, but Pseudomonas is the main one you need to be aware of. So apart from the fact that, so we just talked about excessive heat, thermal burns. So now we're going to talk about hypothermia, which is just prolonged exposure to elevated ambient temperatures. That's something you're all very well aware of here in Texas. And in addition, you also have not just the heat, you also have the humidity and things like that. So the effects can vary depending on a number of factors. You can have things that as little, I'll say, as like heat cramps. You tend to find that like maybe you go out to exercise in the sun, it's really hot, you don't have enough time, you're not taking enough water to replenish what you've lost. You have excessive loss of electrolytes from sweating, and then it can cause muscle cramping. And then you can move on to having heat exhaustion, and that's because of the excessive fluid loss. It causes hypovolemia, and then the body is trying to compensate for it, but it's not adequate. So one of the ways the body tries to compensate for it is for you collapse. So you lie prostrate, and then you have more of perfusion of the blood, and then so the person tends to recover quicker, and then it helps to restore the equilibrium because you've fallen, you're now on the same level, you have, all those vital organs are perfused, and then, but so I talked about, let me see. So I repeated heat exhaustion here, sorry. So then you have heat stroke. And so for those, heat stroke is when you have a combination of high humidity and high temperature. And in this case, this is more serious. Every year when you have, especially in the peak of summer, you hear, especially those who are elderly or those who are ill for one reason or the other, are the ones that are more prone to this. So you have marked generalized peripheral vasodilation, pooling of blood. You have a drop in blood volume. Obviously, the tissues are not being perfused as they should. Necrosis can set in. Vulnerable muscles, the muscles, and then the myocardium, and all those things. Then you can, of course, you can trigger disseminated intravascular coagulopathy or arrhythmias. Now, I just wanted to stress, when you have malignant hyperthermia, you need to know that it's not due to excessive temperature. It's actually a genetic condition that is due to mutation in the RYR1 genes. This is particularly important for those surgeons who would eventually put someone under anesthesia or things. So what they found out that in certain individuals, when they're exposed to certain anesthetic agents, you have a rapid rise in calcium levels in the skeletal muscle. And because of that, you have muscle rigidity, increased heat production. And if it can happen so quickly, and if the surgeon or the anesthetist or whoever is there is not aware of what is happening, it can easily be rapidly fatal. Fatality rate is as much as 80%. But if it's detected, you give muscle relaxant and the patient is okay. So malignant hyperthermia is not caused by excessive heat. It's actually a genetic condition. And then I put this slide here because it's of interest to us as dentists. There's a condition that is referred to as anhydrotic ectodermal dysplasia. There are different things in terms of it's usually inherited, and there are different patterns. I think it's autosomal recessive now. Is it X-linked? I think it's X-linked because you tend to find it more in males. So what you find out, if you look at the patient on the left, you have that sparse hair that is typical. Sometimes they have loss of eyebrows and things. What do you see about the pan here? To your right. No teeth. No teeth here. So they usually, so they have a condition that is referred to as anodontia, which is complete loss of teeth. You don't have any teeth in the mouth. You can also have partial anodontia that is usually referred to as oligodontia. And so you might have like just a few teeth, maybe 2, 3, maybe the mandibular incisors, and they tend to be pointed, kind of conical. So a patient might present to you like that in the clinic. What is important is that part of the things they have, the anhydrotic, has to do with sweating, right? So they have, one of the problems they have is that they have issues with their sweat glands. So they can't, they have an absence of sweat gland. Can you imagine if you couldn't sweat? So they build up internal heat so easily and so quickly. So if somebody like that presents to you in the clinic, it's important that the area is well ventilated and the temperature is even higher than what it would be, cooler than what it would be normally, because, usually these children, the parents from time probably would have picked up that before that time. They might go to school and you hear like, oh, they fainted and things like that. So You have to actually monitor them, and eventually you just put make dentures. I mean, as they grow older, you know. But the main thing I wanted to stress is the fact that they tend to have absence of sweat glands, and they can really have issues with sweating and being able to control their body temperature. So for electrical agents, it depends on obviously the current that is passing through, the amperage of the current, and also the path through which it passes through the body. So the two main problems are, one thing, it causes burns. The other thing is that it interferes with the electrical, what you call it in the body now? No, so the electrical, when you talk about the signals, so eventually what you have is, you have fibrillation, right? What you call the electric signals in the body. And so what you have is ventricular fibrillation, and that can create, when you have fibrillation, remember when I talked about atrial fibrillation, I said you have these abnormal signals, so it's not pumping as well. You don't have blood going from atria. This one is actually ventricular, but when I talked about atria, AF, you know, so you don't have blood going into the ventricles as you would, and then you'd have what? Okay, so the voltage, low voltage injuries are what you typically encounter in the workplace or at home. And one of the downside of this is that with these alternating currents, if it happens, the individual who touches a naked wire or something would, you know, just rather than letting go, there's that reflex thing that where you have, it causes tetany in the muscles, and you have this spasm, and they hold on. And obviously when they hold on, that will even increase the amount of, or prolong the period for which you have current flow. The high voltage will do mainly, low voltage is what really is of interest to us, and that's a poor child who had electrical injury, you know, playing around in the house. You go to where the cable is, nobody's watching, bites on it, and has these nasty injuries on his lips. So you have the high voltage ones that come with those who work with power lines, or maybe you're struck by lightning. So finally, with ionizing radiation, when it comes to radiation, we need to know there are two main types, ionizing and non-ionizing. With the non-ionizing, they don't displace electrons from atoms. They might cause a little shaking, but they don't actually displace it. And those are the ones you see with UV light. We've already talked about some of the consequences, causing, you know, damage to DNA. But then you also have other sources are from infrared, microwave, and things like that. But the main ones we're going to focus on are the ones, the ionizing one, where they actually displace an electron from an atom. The free electrons now collide with other atoms, cause the release of more electrons. And that's what is the principle behind X-rays, gamma rays, and all that. They usually have electromagnetic waves of high frequency. And then you have the other types, which are the high neutrons and the alpha and beta particles. What is really of importance to us when it comes to ionizing radiation is in relation to healthcare, right? It's a significant source of ionizing radiation, and accounts for about 18% of the total ionizing radiation that one is exposed to here in the US. And it mainly comes from medical devices, appliances, and also things like radioisotopes. These are used for treatment, cancer treatment, to destroy cancer cells, and they're also used in other things, other aspects of nuclear medicine in terms of diagnosing and, you know, for diagnosis and therapeutic purposes, and also even for monitoring, okay? So when you, like the tagged isotopes that they have used to treat hyperthyroidism, from measuring the levels, they can tell whether the person is responding to treatment or not. But the downside is that you have side effects. It may be mutagenic, and these are mutagenic, carcinogenic, or teratogenic. What's the difference between mutagenic and carcinogenic? So that something is mutagenic does not necessarily mean it's carcinogenic. It may create, you know, but yeah, with cancer, of course, you have series of mutations that eventually lead to carcinogenesis. So some of them can be mutagenic, which is one can push you one step along towards that process, or even when you have when you have those mutations, the body has checks and balances to try and obviously overcome that. It's when it's unable to overcome that you now have, when they escaped the protective mechanism in the cell cycle check and balances that you have, then you can now start talking about carcinogen. So for teratogenic is what? Causes birth defects, okay? So this is basically it. You have ionizing radiation, you have direct effects, indirect effects. Bottom line, they tend to produce free oxygen or free radicals. So they cause DNA damage, and they can, if the DNA damage is too much, they will be programmed to die. If they manage to escape, or they can go into a place where go out of the cell cycle and go into resting phase where you have DNA repair, and then they can get back into the cycle, or they can escape that and then eventually cause mutations, either teratogenesis, cause problems to the fetus or with the adult individual themselves. So the effects of ionizing radiation on cells, you should be able to tell, okay, so what are the nuclear changes that you see? Obviously, if it's causing mutations in the, if we say it's causing mutations, so you have structural changes in the chromosomes, and this may be in the maybe deletions, breaks, translocation, and things like that. Then you have changes within you have a swelling of the nucleus, clumping of chromatin, and things like that. And then, of course, the aim is to have apoptosis, where if it's too large, too much, you can. Apoptosis is when you have, so you have nuclear pycnosis, which is one of the signs that the cell is dying or has died. And then you have the cytoplasmic changes. So not only do you have nuclear swelling, you also have cytoplasmic changes, changes in the mitochondria. Then eventually you have breakdown of the organelles, the other organelles, and the plasmic reticulum, the plasma membrane, and then the cell kind of disintegrates. But on the tissues, so on a bigger level, you're talking about most of the time it has to do with the vascular changes and then the fibrosis that are associated with it. Sometimes if the vascular changes are acute or severe enough, you can have necrosis of the blood vessel walls. So these are just the effects of ionizing radiation. These are the major consequences. The organs that are most involved are the lymphoid tissue, the gastrointestinal tract, the gonads, and the blood and bone marrow. Can you tell me why? Why do you think these are the ones that are affected the most, the ones I highlighted? Huh? Highest turnover, good. So because they're highest turnover, there will be ones that will be most sensitive and the ones that will be easily, will be affected the most. For men, it tends to be temporary. For women, it tends to be permanent. And then, of course, you have the other things that your hair loss and all. You see someone who's had radiation for cancer, and obviously, they have hair loss and things like that. So finally, you have total body irradiation, where you expose large areas of the body to irradiation. Even in small doses, they can be very harmful. But in higher levels, they may produce what is referred to as the acute radiation syndromes. And so the main systems that are involved, hematopoietic system, particularly for those who have leukemia, lymphoma, they tend to give total body radiation to them. And so you have you can imagine if it damages the blood. So in the blood, you have the fluid, which is the liquid, the plasma, that has also the plasma proteins and stuff, and then you have the blood, the red blood cells, the white blood cells, and platelets. So obviously with that, when you damage the cells, because they're rapidly growing, you'd have decrease in white blood cells, so you have leukopenia. It affects the platelets, you can have hemorrhage. You can also even sometimes have anemia and then things like that. So depending on which organs are involved. So in the GI system, and then finally with the CNS, where you have ataxia, coma, convulsions, and vomiting. Okay? So I just want to, does anyone have any questions? Any questions? Any questions relating to the exam? Any questions? No? Yeah? Yes? So it's in proportion to the lectures. So for all the lectures, she gave 2, right? And the rest are. Was it 1 lecture she gave? Wasn't it 2 days? Oh, you gave, but it's part of. It's part. So it's going to be in proportion to. So it's probably going to be something like 80-20 or 70-30 or something like that.
5 lectures, and then she got 2.
So that's 8, so roughly. Like I already mentioned before, can you just give me a minute, right? I know you have. I mentioned before, when I did the questions, everything was, I basically took the objectives. And so even in trying to set the questions, I'm also kind of inclined to use the objectives. Now, one of the things I emphasized at the beginning of the lecture was just trying to help you develop the habit to go beyond regurgitation of facts and trying to apply. So even though I'm going to ask you questions that are related to what's there, I don't expect, some of the questions will be plain, what are the factors involved in this. But like some of the questions I showed you before, you'd have some types of questions like that. For example, if someone has lead toxicity, I might just lead some of the symptoms, put something that you know is particular to that, and then ask you, what is this person likely to have toxicity due to this or that, So that's basically it. I think most of what you probably need is going to be in the notes. I know you're supposed to read your textbook. The textbook will give you additional information, but I think if you read all your notes, you read your notes in detail. I tried to make it as detailed as possible, so there will be less need to, not less need, but just to help out a little bit more, because I know the textbook is, there's quite a lot of information from there. Okay? Any questions? No? Okay, thank you. Can I, 1 second, please.